Hi winners, very good morning one and all. So this is Dr. Srikanth from team MDS CONQUER. So now I'm going to give a brief glance about yesterday's examination, that is GT5. So first foremost important thing about GT5, GT5 is mostly focusing on module 2 subjects. So more than 95% of the content of GT5 is from module 2 subjects only. So definitely your performance should be better than any other GT in GT5. If not, then you need to focus on. The second important aspect that I want to stress in GT5 examination is there were so many questions. I'm not telling that the question paper is easy, but there are so many questions. In fact, there are more than 110 to 120 questions, means half of the question paper. Okay, even if you are not preparing extraordinary, even if you are not able to work or not able to complete the syllabus extraordinary, there is a scope that you can give a damn performance with 120 questions. So 120 into 4 is going to be 480. So 400 in this examination is going to be so easy. If you are not below 400, then you need to think over seriously. Okay, so I'm splitting the contents, I'm splitting the tasks and everything from now because we are done with GT5. If your performance is not 400 on average in GT 1, 2, 3, 4 plus 5, okay, add those scores and divide it by 5. If it is not more than 400, then you need to take preparation very seriously. Okay, you're reading, but there is some issue with the pattern that you are reading. So that may be the biggest reason why your performance is not up to mark. So you need to focus on and you need to follow. For example, if you list out the what, I'm just telling the WhatsApp activities. Okay, if you just list out what has been done from the module 2 has started. So first and foremost, we have posted oral histology slides video. Okay, there were like 2 questions from oral histology slides video. So 2 into 4, you'll get 8 marks. Okay, then there were so many things that are discussed as we go deep into the preparation. So I'm just going to highlight few important aspects which were given in the examinations. Okay, so one is about microbiology. There were so many things about microbiology that has been repeated in the examination, and there were lots of things, like for example, in yesterday's paper we have questions like cotton wool appearance was a straight away diagram which has been discussed, and followed by starry sky appearance was discussed day before, 2 days before the exam. The questions were given. Mode of inheritance was discussed. You have questions on mode of inheritance, and followed by there were questions on Carey's oxygen's imperfect is due to the defect in synthesis of, okay, yeah, you're right, so many of you answered it as right, collagen. There were so many such questions that are being discussed on the group, and they were straight away given in the examinations, like stains of amyloidosis was question given, a minimum inhibitory concentration question was given, and vitamin K related questions were given. And you have questions on hypertension, having diabetes, proteinuria without renal failure, and anti-hypersensitive drug of choice was again a question that is given in yesterday's paper, followed by, of course, cotton wool. Straight away you have a question. Apert syndrome, you have a question on Apert syndrome, diagram based question. Acromegaly, you have a question on diagram based. So there was so many such things like given in the yesterday's paper. Proteins of sarcolemma was a question straight away repeated. Next, followed by virus seen in the case of a transplant patient, a lengthy case based question again was repeated. Microbiological how it Clostridium tetani, how it looks like, was a question. That is your drumstick or a club shaped appearance in microscopic feature was a question. Trisomy, you have a question. Okay, so trisomy, you have a question. Epstein-Barr virus, you have a question. Components of a triple response, you have a question. Coming to JPV, you have a question. ECG, you have a question. Inflammatory bowel disease question was repeated. Okay, that's about Crohn's and ulcerative colitis. The questions were repeated, and followed by, you have a question on mycoplasms histology. You have a question that is being repeated. Perry-Robinson syndrome question was repeated. So many of you answered it right. Vitamin D, I have discussed, the question was repeated. Loss of lamina durae seen in all of the following except the question was repeated. and followed by hairy tongue question. Right. Then after punched out lesions seen in the case of your hand radiograph, finger radiograph was repeated. Okay, and then after, I mean, there were so many such questions which are straight away repeated from the activity. Okay, it can be your Duke's criteria question was repeated, followed by the lifespan of neutrophils was repeated, and John's criteria question was repeated. Next, rheumatic fever related questions were repeated. Rheumatic fever walls related questions were repeated. Patches, silent chest, that is your Graves prognosis question was repeated. Followed by the most common type of carcinoma of the lung, that is adenocarcinoma of the lung, was a question straight away repeated. And the diagram of sagospleen was repeated, and diplococci question was indirectly given, right? So there are many such things like prone position to carry out oxygen saturation levels. Straight away the question was repeated. Patient developed acute asthma in the dental chair, drug of choice question was repeated. Father of forensic odontology was repeated, and followed by ascites question was repeated. Bamboo stick appearance question was repeated. Which of the following act as a major neurotransmitter, that is dopamine? The question was repeated. There are many such things which were repeated. Okay, there were 3 or 4 questions repeated from Sahiti ma'am's Pro Live class. Vitamin deficiency, that is nowhere related to the periodontal ligament, the PDL, that is vitamin D, that question was repeated. There is some diagram based question given on your gingival inflammation, which vitamin is mainly associated with. Vitamin C is mainly related to gingivitis, that question was repeated. And they were very easy and simple questions on cysts, tumors, where you can, like, if you go wrong in pharma, if you go wrong in general medicine, if you go wrong in physiology, that's okay. But if you're going wrong in oral pathology, even after reading, if you're not reading, okay, find a way to read. Even after reading, if you're not going right, then we need to think about this, then we need to sort about this as fast as possible, because we are short of time. Starry sky appearance question was repeated. Okay, right. So there are many such questions which are simple and easy. Like, to my calculation, it turns around like 100 plus. So even if you just mark those 100, so you'll get 400 plus. It's very easy to score 400. Just keeping yourself limited to only the group content. Don't do any extraordinary. Just to follow the group content. Do the quick revision video. Or if you're Pro Live student, do the Pro Live. If you're offline student, do the offline papers. And do whatever that is being posted on the group. In yesterday's paper, it is very easy to get 100 marks. 100 into 4, 400 it will be. So if you're not crossing that 400, okay, then you need to think very seriously about this. Okay. So the next one, what I want to stress on is things to be done. Okay, so if your score is below 400, I want you to stick on to only these things. For example, if you're a regular student, you can go with quick revision videos followed by the group content and followed by only the MCQs of every subject, the recent MCQs and topics from 2021 to 2011. Make sure this has to be done at least 5 times. If you are not crossing 400, you have to do it 5 times. Then only you can cross 400. If you are still below 300, 200, you need to think, you need to do this 5 times. Then only there is a chance that it is going to be possible that you are going to hit that 400 mark. And you have to take things very seriously, because we are running short of time. We are hardly 65 days towards the examination. And this is a peak time where you need to take the calls and decisions perfectly so that your scores will improve drastically. So once a student hit that 400, 500 mark continuously, there is a scope that he will move ahead in scoring better. If you're not doing it, take things very seriously. So people who are crossing 400 in the range of 400 to 600. So my suggestion is, apart from these 5 times revision, I want you to check out the website content. That is your questions, explanations. Okay. So make sure you do the RQs from 2021 to 2001. And people who are above 600, good. I'm very happy for you. Okay. But do maintain that integrity in the preparation and take care of yourself during the preparation. emotionally, mentally, physically. Okay, I want you to do everything along with these things, everything whatever you have done in the round 1 or round 2 of a particular subject. Okay, so people, please do start. Magics can happen in the last 2 months also. There is still a scope, chance that your performance can be improved, your preparation can be extraordinary. The only thing is follow up with the mentor, talk with the mentor, do what mentor is telling. If you're still not able to score 200, 250 after reading vigorously every day, then there is the biggest mistake that is being with you in the mode of your preparation or the mode you give the examination. So think over, talk with the mentor, okay? Talk with the mentor. Straight away questions are given, okay? So if you just check out the last 3 days content of WhatsApp activity, there were many questions directly, indirectly discussed on the group and posted in the form of a notes. If the same question is repeated in the exam and if you're going wrong, then who is going to help you? No one can help you. So my suggestion is, don't read everything. Read what is really required. Read what is really required. Read what is, first of all, give you a scope to go 400 plus. How a person can go 600 or 700 plus is first reach 400 is a minimum score. You have to, okay, to get into the competition. First you have to reach 400. Then you can move yourself from 4 to 5, 5 to 6, 6 to 7, or 7 to 8. So first 400 is mandatory for everyone. If you are not able to reach that 400, please do this 5 times only these things. Then try to give more exams. Then try to attend more activities. Try to analyze why the answer is this. Find out the reason and just try to read and go. I'm seeing students who are just reading the question and reading the answer, just mugging. This is not going to work out, guys. Trust me, this is not going to work out. Certain questions or certain contents or certain subtopics in a particular subject, you can do this, but you cannot do for every question that is being posted to you on the group or in the examination or on the discussion. Okay, make sure, take things seriously. Here we have mentors who are going to help you out, which may not be possible in many other areas or many other apps or anything where you don't have a mentors. Here mentors are sitting for you. Okay, so please try to talk with them and try to find out where you are facing an issue and try to take suggestions from them. Try to start implementing those suggestions in the preparation and try to see betterment in your preparation. All the best. Stay positive. Take care.